Hello, welcome back to Polymeric Biomaterials. We are now looking at the theme of bulk behavior and responses, under which in the previous lecture we've started looking at mechanical properties and responses, and in today's lecture as well we will continue that theme and look at some concepts that we had started off in the previous lecture, and we will look at some deeper aspects of those concepts in today's lecture. So what we will be doing today is first recap some key concepts that we've already seen in the previous lecture, namely lecture 22, and then from there on we will start looking at testing conditions and those effects. For example, we look at the effects of temperature and strain rate, both of which have to do with the conditions under which the biomaterial is tested or the polymer is tested. We will also see the role of microstructure here. How does the presence of crystalline domains impact the kind of properties you get? How does an amorphous polymer give you certain kinds of properties? And also closely related to that is the idea of molar mass. So we look at all aspects of microstructure that have a direct impact on mechanical properties. And then we will move on to other concepts like aging, which is something that is very important for biomaterial testing. And then we will also look at the effects of porosity and degradation, and towards the end we will quickly take a look at some other modes of testing, namely compression, torsion, flexural and impact testing, and at the end we will finish with some comments on some possible failure modes that can occur in such kinds of polymeric biomaterials. So with that, we will get started with today's lecture, and we will begin by recapping some key concepts that we have seen earlier. And just to note, these are all concepts that we have seen as part of tensile testing in lecture 22. This is just a one slide summary of some key concepts that we will later use in today's lecture. So we have already seen that broadly there could be 4 or 5 types of loading modes, namely tension, compression, shear, torsion and bending, depending on what kind of polymeric biomaterial you are using, in what application and which location. One or more of these modes may be important. Of course, there are other modes as well that we will not be covering, but those could be more specialized. And in all of these, what we are trying to ask is find a broad relationship, try to understand the relationship between load versus deformation. If you apply a load, how does the material deform, or does it deform at all? So these are all questions that we asked in the previous lecture, with a particular focus on uniaxial tensile testing. So we saw that broadly, if you look at the elastic portion of the curve, you can have those load and unload cycles where stress is only a function of strain at that point in time. The history, for example, does not matter, and that linear relationship in the elastic region between stress and strain gave us the modulus of elasticity, right? And we saw that stress and strain are mechanical variables and not so much properties, whereas modulus of elasticity is actually a mechanical property. A closely related concept that we saw as part of the elastic regime was the idea of resilience, which is the elastic energy absorbed given just by the area under the curve in the elastic region. And then we also saw that you can also have plastic deformation or ductile behavior, where the material can deform and plastically permanently deform and yield before it fails. So based on that, we saw that you can also classify materials as ductile or brittle, or as an elastomer. And there are characteristic curves that we saw for stress versus strain for each of these. For example, brittle materials will catastrophically fail for very low deformations itself. They will show high modulus, but they will also fail very rapidly. And they will also not deform before failure, right? They will not show any significant deformation before failure. In contrast, we saw that ductile materials can deform significantly, yield and show permanent plastic deformation before they fail. and rubbers like elastomers, etc., they can undergo deformations to very large strains before they eventually fail. So, closely related concepts we saw were the idea of yield strength, which is just the stress at the yield point, beyond which if you go, you will largely not be able to recover the strains. Essentially, at that point you have started making permanent changes to the network. We also saw that you can define something called a tensile strength, which is just the maximum stress before the material, the polymer fails. This was just one example of a ductile plastic material that's whose stress strain curve is shown. You can also have strain at break, which is simply the amount to which the material has deformed before it has failed. And toughness, of course, we saw was a very specific engineering term that had to do with the amount of energy absorbed before the material breaks, and mathematically it is simply at the area under the entire stress strain curve, right. So, these are all concepts that we have seen in the previous lecture. We are just recapping some of these, and our intention in today's lecture is to start from this point and try to look at the effects of temperature, the presence of solvent, and the role of microstructure towards influencing some of these properties. So, with that quick recap, we will now move to this idea of temperature and microstructure effects. See, first of all, you have to keep in mind that all these biomaterials, many of them, if they are intended for implantation or use in the body, they are going to be used at 37 degrees Celsius, which is the body temperature. And whether you like it or not, there is an aqueous environment, which is essentially a buffer, if you will. And both of these factors have to be considered very carefully when designing any kind of biomaterial, particularly polymers, because we have already seen quite extensively in earlier sections of this course that there are specific transition points in polymers, such as glass transition, melting temperature, etc. So, what is important here to keep in mind is to contextualize your use temperature against some of these transition temperatures and then look at mechanical properties from that perspective. And of course, the aqueous environment will have its own effect on polymeric biomaterials. For example, water will plasticize the material. Water is a universal plasticizer. So, the buffer in the body is going to plasticize the material, right. So, that will have its own effect. So, all these factors have to be considered and accounted for when you are testing these polymeric biomaterials to look at mechanical bulk properties. Now, a couple of quick comments in that regard. So, like I just said, the operating temperature should be contextualized vis-a-vis the Tg and the Tm of the polymer. Now, if the operating temperature or the use temperature, sometimes this is also called the temperature at which the material is used or deployed. If that temperature is less than Tg, then for a semi-crystalline polymer at least, what you are going to have is arrested chain motion, and this is also true for an amorphous polymer for the glassy chains, where the material is largely going to exhibit glassy or brittle behavior. Now, when you go above the Tg, when you cross the Tg either for a semi-crystalline or an amorphous polymer, the chains become mobile, or more correctly, you get higher segmental mobility. So, when I say chains here, what we really mean is segmental mobility is enhanced, higher free volume, and at the bulk you end up getting rubbery and elastomer like behavior. And that is why if you see, most elastomers will be used above their glass transition temperature. So, again, to keep in mind that the Tg of the polymer here plays a critical role and should be contextualized against the body temperature to determine whether it is going to be more glassy and brittle, or is it going to be rubbery and flexible. So, this here should be interpreted to mean flexible. Of course, there is the plasticizing effect of the buffer itself. This is just the presence of water in the aqueous environment in the body. And for semi-crystalline polymers, if you can go to one more transition point later, which is the melting temperature. Now, when your operational temperature is close to the melting temperature, you get significant full-scale chain motion, you get breaking of all the secondary bonds, and you get crystallite melting. So, what you will end up with at the end of all of that is a viscous melt if you have gone to that temperature. So, those are all the possibilities going from below Tg all the way up to Tm and beyond. Now, obviously, from a processing perspective, one can think about operating beyond Tm, because that makes it easier for you to process materials, but when they are eventually deployed, you want to be well below those kinds of values, right. So, largely it is the Tg that will really matter, and mostly you will be focusing on this aspect, whether the chains are rigid and the polymer is behaving like a glass, showing brittle behavior, or are the chains or the segments showing mobility, resulting in rubbery and flexible behavior. And like we said, for a semi-crystalline polymer, you have both domains, and from a bulk mechanical perspective, it is the crystalline domains that will contribute to the stiffness and the brittleness of the polymer, and the amorphous regions will contribute to the flexibility and the resisting behavior, or the elastic behavior, so to speak. And we saw in the earlier lecture also that in the elastic region for a semi-crystalline polymer, when you deform, we looked at it from a molecular picture, and we saw that, or we observed that it is primarily the amorphous regions that first respond, and because they are disordered, once you remove the load and you are still in the elastic region, the polymer will recover its entire shape, the original shape, and that is because largely it is the amorphous regions that are contributing to that property. Now, you can now ask, what is the effect of temperature on modulus, which is one property that we have seen, and we are showing change in modulus with temperature here, because our interest is to look at the effect of temperature on mechanical properties and to contextualize it against the transition temperatures in polymers, namely Tg and Tm. And shown here is the plot of log of modulus versus temperature for two different types of polymers. One is a linear amorphous polymer shown in the blue trace here, and the other is a semi-crystalline polymer shown in the black dashed trace here. So, this would be this and this would be this. So, let us take a quick look at these trends and try to understand from a molecular perspective what is happening. So, let us start with the linear amorphous polymer first. Now, if you are below this temperature, you are operating in the glassy regime, which means you are going to have a fairly high modulus, and as you approach Tg from here, you see a significant drop in modulus, and you end up in what is called a rubbery plateau. This region is called the rubbery plateau, and in this region the chains or the polymer will be more soft and flexible, right. And if you go beyond, because this is a purely amorphous material, you will see a second large dip in modulus. It is not correct to call it melting, one can think of it as flow. Sometimes it is called the flow temperature, so that the polymer starts to flow, but it is not melting because there are no crystallites here. Remember, it is an amorphous polymer. From a molecular perspective, what is happening here below Tg is the chains are rigid and frozen, leading to glassy and brittle behavior with a high modulus, and you see a drop in modulus around the glass transition temperature, a large drop, resulting in or leading to a rubbery plateau here, where beyond Tg you get flexibility because of increased segmental mobility and increased free volume. So, that is the case for the amorphous polymer. Now, we can turn our attention to the semi-crystalline polymer, And again you will see that the semicrystalline polymer below the Tg, which pertains only to the amorphous regions in the semicrystalline polymer, you are going to have rigid and frozen chains. So, you are still going to get the glassy, brittle kind of behavior with a high modulus. But as you approach Tg for the semicrystalline polymer here, you see that like the amorphous polymer, even here there is a dip or there is a decrease in modulus. Remember, this is a log scale. There is a decrease in the modulus, but the decrease is not as dramatic as we saw for the purely amorphous polymer. Now, can you try to justify why that is the case? Why don't we see a significant dip as we saw with the amorphous polymer? If you have understood microstructure of polymers well, you will be able to immediately tell that while there is a dip, the dip is not that significant as you saw for amorphous polymers, because the crystalline domains still are contributing to the modulus significantly, right. So, because it is a semicrystalline polymer, the crystalline domains will still contribute to the stiffness of the polymer. Now, again if you go beyond, you see the rubbery plateau here more prominently, where because you are now above the Tg, the amorphous domains are now flexible because of high segmental mobility. And at the Tm or the melting temperature, again this corresponds to the crystalline domains, the crystallites in the polymer or the lamellae if you will. So, this pertains to the tie molecules, this pertains to the lamellae in the folded chain model of polymer microstructure that we have seen quite extensively in lectures 12 and 13. So, now would be a good time to pause and recall some of these ideas that we have already seen in great detail in lectures 12 and 13 for microstructure and TGTM effects. What we are doing here is to understand in turn how those have an effect on the mechanical properties. So, here at Tm, like I was saying, the melting temperature, at and beyond you see again a dramatic or a drastic drop in modulus, and that is because you have gone from a solid like material to a viscous melt here beyond the Tm. So, the crystallites have all disappeared now, and what you have is no longer a solid polymer, but a liquid or a viscous melt, where you have full scale chain motion as opposed to segmental flexibility that you had with or segmental mobility that you had just above Tg. Now, depending on the size of the crystals etc., this can occur over a range, even Tm can occur over a small range, right. But the point to note here is that the drop here is pretty dramatic. So, that is the situation for modulus versus temperature for both linear amorphous and semicrystalline polymers. So, that is a good starting point for us to understand further concepts as we move along. Now, we are going to connect now what we saw on the first slide in terms of recapping some of the concepts from the previous lecture, and what we saw on the previous slide in terms of temperature effects. Now, if you can recall from our earlier lecture and also from the first part of this lecture, we saw that you can have both brittle and ductile kind of materials, right. Those are two classic textbook examples of stress strain curves shown here, where the brittle material is going to have a very high modulus. It is also going to fracture or fail catastrophically here without any significant deformation, whereas the ductile material is going to plastically deform and yield quite a bit before it is going to fail here. So, those are the two extremes, and you can have amorphous semicrystalline thermoset kind of polymers showing brittle behavior. You can have amorphous semicrystalline or thermoplastics showing ductile kind of behavior. Now, what we are now going to do is to look at the effects of temperature, and we are going to see that these are not necessarily, these do not have to be necessarily two different materials, but the same material can show brittle or ductile behavior depending on the operating temperature. in a phenomenon that we call brittle to ductile transition. So, in terms of the failure, what you have is, in the brittle case, you are going to have a clean breaking for that kind of a material at failure, fracture, versus deforming significantly before failure in the form of necking that we have seen again in the previous lecture, right. So, our contention is that depending on the operating temperature vis-a-vis the Tg, etc., you can actually have the same material show glassy brittle behavior at a certain temperature, and at a different temperature it can sort of now deform, yield, etc., and neck significantly before it fails. And shown here is a plot of that. So, this kind of a curve or a line you see for hard and brittle materials, where the primary mechanisms involved are molecular breakage. You are looking at largely covalent bonds suddenly rupturing, leading to catastrophic failure at this point. It fails without warning, it will suddenly fracture, but the fracture will be clean because it is a brittle material. So, it means it is not going to deform or yield to any significant extent. Now, as temperature increases this way, you start to see on the other side, you get a ductile tough material. Toughness simply has to do with the fact that the area under the curve is quite high, which means it can absorb a lot of energy before it fails, and the fact that it is ductile means it is going to deform significantly and undergo permanent plastic deformation and yield neck, etc., before it fails. And the mechanisms involved here have to do with chain reorientation, segmental realignment, slippage across chains, right. That all of these mechanisms allow significant deformation and yield before the polymer fails, whereas this kind of a mechanism will make sure that the failure is catastrophic. Now, from top to bottom, this direction, we have seen the two extremes, hard, brittle and ductile tough. You can have other varieties. So, the other types of curves shown here could be hard and strong, hard and tough, etc., right. So, you can have mix and match of different kinds of properties depending on what temperature you are operating at, right. And typically with increasing temperature for a material that can undergo this kind of a transition from brittle to ductile, you will typically see that increasing the temperature usually results in decreased elastic modulus, lower tensile strength, but higher ductility. Now, one example that we are going to see will sort of make this more clear, and we are going to look at the example of polymethyl methacrylate, whose Tg is around 110. What you will see here is we are plotting stress versus strain as a function of temperature here, and temperature increases as you go from top to bottom or left to right. Now, you see, for anything less than 30 degrees, right, the material is largely behaving like a brittle material. But as you keep increasing the temperature and you start approaching close to the Tg, right, and in this case greater than 80 degrees, you start to now get ductile plastic behavior as shown here. Same material depending on the operating temperature vis-a-vis the Tg being close to 105-110 degrees Celsius. As you start approaching that temperature, you start to see that what was initially glassy and brittle at much lower temperatures has now become more ductile plastic like behavior at much higher temperatures as you approach Tg. So, now at around body temperature, because it is much lower than Tg, the chains still do not have enough segmental mobility. So, it is not going to behave like a tough and a ductile material by any means at 37 degrees Celsius, right, because even at, you see, at 20 and 40 you still largely get brittle behavior. So, it is not going to be tough and ductile at 37 degrees Celsius. That also explains why PMMA has low fracture toughness, and one manifestation of that, what that low fracture toughness simply means that it does not have the ability to absorb a lot of energy at this particular temperature. So, the operational temperature matters here, because you see the area under the curve is very small. So, it can fracture very easily, and one manifestation of that is often seen when PMMA is used as bone cement, and it is prone to cracking. So, that can be a problem potentially when bone cement is used. So, now that we have seen the effects of temperature vis-a-vis the TG, we saw that around the TG is where you start to see that brittle to ductile transition, and that has to be related to the microstructure. You see, so that is why we are looking at temperature and microstructural effects sort of together. You can't sort of decouple them because one is related to the other. So, now that we have seen how this transition occurs, we will next explore the role of microstructure a bit more, but again contextualizing it to temperature. The first thing we are looking at here is to note that the factors that restrict chain motion or segmental motion increase the strength or modulus and decrease ductility. And we have earlier seen in previous lectures, we have already looked at factors that restrict chain motion or that hinder segmental mobility. And now you can sort of go and make the second argument, which is to say those kinds of factors will now have effects on the bulk. So, again what we are doing is we are connecting microstructure to bulk mechanical behavior. This is a very important connection we are making. So, you see things like crystallinity, which you can think of in terms of microstructure. A higher crystallinity is going to resist deformation more, leading to higher modulus strength, etc. Right? A higher molar mass, for example, we saw earlier that is going to restrict chain motion, and because of the higher entanglements, again you can see why that is going to lead to improved mechanical properties in terms of strength or modulus. Likewise the case with rigid backbone or side groups, likewise the case with cross-linking. Thermosets, for example, which are extremely cross-linked networks, won't be ductile, right? They will be more brittle because that cross-linking is again going to hinder any kind of segmental mobility or chain motion. Likewise, for ductile or plastic materials, you can have yield strength that is going to decrease with a plasticizer or a solvent addition. Even water alone is in many cases is good enough to do it, and of course it is going to also change with crystallinity. And likewise strain at break, which is another property that we saw earlier in this lecture, tends to decrease with decreasing molar mass, and that again has to be contextualized against decreased molar mass is going to lead to lesser entanglements, which means the material is going to fail at lower strains, right. So, that is the sequence of arguments that you have to make. Now, shown here on the right is a plot of a qualitative plot of log of modulus again versus temperature, just as we saw on the previous slide, but now here we are looking at the specific effects of microstructure vis-a-vis TG and TM. And what you have here is going from left to right or bottom to top, you have increasing crystallinity for the same material. So, this curve here represents almost entirely purely crystalline material, where you largely see brittle behavior, and there is a transition that occurs, but that transition can be correlated to TM. So, you see the decrease in modulus happens only at TM. So, one can immediately say that this is mostly a crystalline material, right. So, 2 points. One is the fact that there is a transition, a sharp drop in modulus which occurs only close to the TM, and this kind of a material is going to show mostly brittle behavior. But as you come down, as the crystallinity decreases, what that happens is the introduction of the amorphous domains is now going to lead to ductility or ductile behavior. And the other point also to note here is, as that happens, because you have these amorphous domains, you see a second transition happening close to the TG for these kinds of materials. So again, 2 points here as well. The first is, as the crystallinity starts to decrease, the content of crystals in the material starts to decrease, which is going from top to bottom this way. You start to see a transition going from again mostly brittle-like behavior to some kind of a ductile kind of a behavior. The second point to be noted is, you see a second transition also occurring in these kinds of materials. Now, because you have amorphous domains, so now TG also becomes important apart from TM, and you see that these materials will show a transition around the TG as well, wherein you see again a drop in modulus there. Of course, these materials will again show a second transition here at TM, as we have already seen, because the crystals will melt at that point. So that is a good way to now think about crystallinity and the effects of microstructure, but contextualized against temperature on mechanical properties. In this case, we are looking at modulus. And now, another way to think about structure affecting properties is something that we have looked at earlier, which is molar mass. And this is a very nice plot of temperature versus molar mass. This is a map in some sense, where you are looking at different combinations: low temperature, low molar mass; high temperature, low molar mass; low temperature, high molar mass; high temperature, high molar mass, right? I mean, those are some regions you can sort of map here. What this shows is that depending again on TG and TM, for very low temperature, low molar mass, while you can have a crystalline solid below for very low temperatures, like I said, for very high temperatures, and if you do not have enough molar mass, you can go to have a flowing liquid, right? But if you now have a higher molar mass, like for polymers for example, at very high temperatures, particularly beyond TM, you will start to get a viscous liquid, right? Again, at very high molar mass below TG, you will get a semi-crystalline plastic material, but you can also get a tough plastic above TG. So, in one map, what we are showing is the effect of chain length or molar mass versus temperature, and how those together determine the mechanical properties of the material, or how we classify materials based on the ability to deform in response to a load. That is essentially what all of these things are, right? How do these materials behave macroscopically? For example, a viscous liquid versus a semi-crystalline plastic, right? Either how they behave macroscopically, mechanically, or how they deform in response to a load, and how that in turn is affected both by temperature and by molar mass. So that is a very nice summary. With these two, now you should get a really good sense how microstructure and temperature together affect mechanical properties. Now, another very important property or another important operating condition which will also have effects is strain rate. Now, we have sort of hinted at this earlier, that the rate at which you are pulling, right, the sample, there is an intrinsic strain rate associated with it, and that strain rate will have the units of time inverse, second inverse, for example. So, 1 over strain rate will give you a time scale. So, this will give you a time scale. That is the time scale over which you are testing the material or you are deforming the material, and there is also a time scale associated with molecular mechanisms, for example, in terms of relaxation, right. What you want to ask is, in comparison to those kinds of time scales, and relaxation time scales can be multiple in polymers, you can have based on what you are looking at, right, bond, segment, chain, bulk. So, there can be multiple relaxation time scales depending on the length scale you are looking at. So, multiplicity of length scales associated with the different relaxation times, right. Now, depending on what the time scale associated with your strain rate is, that has to be contextualized against the different relaxation time scales noted in the polymer. And because you are dealing with two time scales, as an engineer, naturally you can think of a non-dimensional number that can give you some idea about relaxation, etc. And in this case, it happens to be the Deborah number. Now, this is something again we will look at in far greater detail when we look at viscoelasticity in polymeric biomaterials. Essentially there, we will see that time becomes very important, and we are sort of seeing that here. There is a temporal scale associated with the strain rate, and time becomes important because mechanical properties now for these kinds of materials that are viscoelastic will depend on time. So, if they are purely elastic, then it does not really matter what the time scale is. Stress is always proportional to strain. But if you have viscoelastic or viscoelasticity, which is what you will see in many polymers, now this part will now start introducing time dependent mechanical properties. Two manifestations of those which you will see later are creep and stress relaxation. So, this we will look at in some detail when we look at viscoelastic responses. But the reason I am saying that here is the point to be noted about the relevance of time scales in this problem coming from strain rate and the intrinsic relaxation processes that happen in the polymer. Now, if you think about these two, what you see is this is a plot that we have looked at earlier, where we saw that if you go from here to here, we said increasing temperature, right. So, temperature goes up as you go from top to bottom. Interestingly, you see that the effect of strain rate decreasing follows a very similar trend, right. So, what you already see here is that what you can get at low temperatures, namely brittle behavior, which is what you would see here, you can actually end up getting at high strain rates, which is again what we are saying here. Essentially what is happening is when you pull the material too fast, which is what a high strain rate is, you do not give enough time for the deformation and yielding processes to happen. And that again has to be connected to reorientation, slippage, etc., which again can be connected to the relaxation time scales. So, if you pull too fast, you are not giving enough time for reorientation, slippage, etc. Essentially, you are not giving that material or the polymer enough time to deform or yield. So, it is going to largely show brittle behavior. But as you go to lower and lower strain rates, those processes now can happen, giving rise to more ductile behavior. So, that is why we are saying for a very high strain rate, the same material can behave like a brittle and a rigid material, and for a much lower strain rate, the same material can behave like a ductile and a tough material. Now, this is exactly what we said about the effects of temperature, but the inverse. There we saw that at very low temperatures, you see this kind of behavior based on whether it is above or below Tg, and what high temperatures, particularly if it is above Tg, you will get this ductile or tough responses. And again, just as we saw that if you increase the temperature, you get decreased elastic modulus, lower tensile strength and high ductility. We are also saying here that decreasing the strain rate is going to also lead to decreased elastic modulus, lower tensile strength and higher ductility. So, this should also convey to you a very important point about the use of standards in testing, because you can get very different mechanical properties based on the operating conditions, based on the testing conditions. It is very, very important to keep in mind two things. The first thing is, what is the eventual environment of deployment. So, where is this material going to be used? What is the temperature in that region? What is the pH? What kind of mechanical forces will this material be subject to in that portion of the body or in that region of the body? That's the first thing. That has to be, all of that has to be accounted for when you test the material. The second thing to be accounted for is using standards, either ASTM or ISO, depending on what your preference is and what is appropriate for your material. You use standards because standardized testing conditions ensure that you can now compare material properties across different kinds of materials and devices. That's an important point to keep in mind. And why is this important? Because of the significant effects of testing conditions such as temperature and strain rate on the resulting mechanical properties. Not just the numbers themselves, not just the value of the modulus, not just the strain at break, etc., but whether the material qualitatively will behave like a brittle material that will fracture, or like a ductile material that will significantly deform and yield before it fails. Even that can be determined by both temperature, again contextualized against Tg, as well as the strain rate. Of course, microstructure is intrinsic in all of this. Now, another important aspect of deployment and use is this idea called aging, right? We are looking at materials that are going to be deployed for a long period of time. So, from an engineering perspective, you can do something called a lifetime assessment. So, when manufacturers say this device will be good in your body, or a stent for example is going to be good for 10 years, how do they determine that? What are they talking about? What happens after that time, etc., is what we are going to look at in aging. Now, note that aging is quite different from material degradation or erosion. Material degradation and erosion can also happen as the material continues to be used in its intended site of deployment, but aging is quite different. Aging, at least physical aging, includes processes that naturally can occur in the material over time, and that is going to lead to a change in properties. So, what we are interested in asking here is time dependence of the properties with use. And aging can occur because of a whole host of reasons. Some particularly important aspects that can result in aging, or that can contribute to aging, include the presence of a buffer with salts, of course effect of temperature, the presence of continued loading that can also influence the properties with time, the role of pH, the local pH there, that is going to cause or contribute to aging. What we are asking here is, when we talk about aging, is with use at the intended site, how do properties change with time? And some examples of physical aging may include natural processes within the material, within the polymer, such as molecular relaxation. You can have crystallization, you can have phase separation. One example of this could be, let us say you take a polymer that has a drug loaded into it. Now, even storing it, forget using it in the body, even storing this, let us say you are looking at controlled delivery devices that want to release drugs over long term, even storing it in the shelf, right, without even deploying it in the body, some of these mechanisms may be at work, right. If you are particularly keeping it annealed or storing it below Tg, over time slowly it can lead to relaxation. You can have the amorphous drug. We have seen that amorphous solid dispersions are one important class of pharmaceutical formulations, and the amorphous phase of the drug is favored because it has higher solubility and higher bioavailability. but the amorphous phase is also highly unstable, right, from a thermodynamic perspective. So, it wants to minimize its free energy and come back to the global minimum of the crystalline state. So, it can crystallize over time and that might negate the advantage that the amorphous phase has in terms of solubility and bioavailability. If you have blends, they may undergo phase separation, right, polymer-polymer blends may undergo phase separation. So, all of these would be what you would call physical aging. You can also have other kinds of aging arising from things like inflammatory processes, oxidative processes or oxidative stress. All of these can also contribute to aging. Now, why is this important? This is important because these factors will contribute to change in properties over time, which is going to change the performance of the material over time. So, again we are connecting, you see here things like molecular relaxation, which has to do with the structure, to some macroscopic property, for example mechanical properties that can change with time, and that is in turn going to affect the performance of the material. So, that is the connection we are trying to make here. Now, for many of these materials, there is something called accelerated testing that is often done, and what that means is when you want to talk about how long this material can be deployed before its properties can significantly change, you can't test these materials for 10 years, 20 years, right, that is not practically quite feasible. So, one way to get around that problem is to do something called accelerated testing, where you use harsher testing conditions than you would need, but for a shorter period of time, right. So, these harsher testing conditions could include higher temperature, lower pH, etc., than the intended implantation conditions, but now you test them over shorter periods of time. So, what you are trying to say is you can find some kind of an equivalence, quote unquote, between testing them under much more stringent and harsher conditions for shorter periods of time than testing them under the intended conditions for say years. What that means is you can now have an increased temperature, but for a short period of time, but then again you have to keep in mind, if you are close to Tg, it can have unintended consequences, right. So, just because you wanted to accelerate testing and you want to increase the testing temperature does not mean you stop paying attention to what the Tg is, because if you go beyond Tg at those high temperatures, you can start now getting other kinds of effects that you may not have. Of course, anyway typically you do not generally operate, at least for these kinds of materials, above 60 degrees Celsius. You can now define something called an aging factor, where it is given by this formula. Essentially, the idea comes from an Arrhenius type of an analysis, where you say that for every 10 degree increase in Celsius, the reaction rate doubles, right. So, this is sort of that empirical rule or a rule of thumb, where you say that for every 10 degree rise in temperature, you are going to make the reaction or the aging process go twice as fast, right. That is what this equation simply means. So, for implantation, what that means is, if your intended temperature of operation is 37 degrees Celsius, which is the body temperature, 1 month tested at 87 degrees is equivalent to aging the material for 32 months at 37 degrees Celsius, right. So, if the material were deployed at 37 degrees under normal aging conditions, it is going to get result in some properties after 32 months, and the contention here is that same kind of aging you can now do in an accelerated manner if you test the material for just 1 month, but at a much higher temperature, right. This is for use in the body, but again for testing shelf life for pharmaceutical applications, for example, this is usually the T0 is the storage temperature. Having looked at the effect of microstructure, temperature and aging and strain rates on mechanical properties, we will quickly look at the effect of the architecture of the material looking at things like porosity and the role of degradation and how that determines or changes the mechanical properties very quickly. So, we are looking at the effects of porosity and degradation. Now, porosity is something that can be engineered into a polymeric biomaterial during processing, and later on we will look at, in a dedicated theme, look at biomaterial processing, under which we will look at some very popular techniques of biomaterial processing that is going to lead to very highly porous materials. One example of that is shown here, electrospinning. We have alluded to this technique before. It is a technique where a polymer solution is subject to an electric field that leads eventually to the formation of these non-woven nanofibrous meshes, and these are very porous. So, that porosity can be useful for a variety of different reasons, can be useful for mass transport, can be useful for release of therapeutic molecules, particularly macromolecules. Porosity can also help with cell and tissue infiltration in applications such as tissue engineering. Right? And it has historically been noted that compared to completely smooth materials, textured and porous architectures typically lead to thinner foreign body capsule, which means that the higher chance that the material is going to be integrated without an adverse foreign body response with the body. Now, that comes at a cost because porosity is going to significantly decrease your elastic modulus in strength, as should be fairly clear to you. Now, just shown here as a comparison, we are taking our familiar example of PLGA, which is a copolymer, right, polylactide coglycolide. If you cast films and you test to tensile testing, the elastic modulus of these PLGA films is going to be of the order of a few gigapascals. But once you make electrospun meshes, so these are PLGA, electrospun PLGA fibers. Now, if you go test them, take a strip of electrospun PLGA and you do tensile testing on it, make a dog bone, do tensile testing on it, you are going to get much smaller, perhaps even smaller than this range shown here for the elastic modulus, right. So, same material, chemistry has not changed, same molar mass, except now it has been processed. So, in addition to the effects of microstructure, temperature and strain rate effects, now we are looking at the effects of processing, because processing directly affects the architecture of the material and also the microstructure. Now, the other aspect to keep in mind is if your material is going to resorb or if your polymer is degradable, that is also going to cause a significant change in mechanical properties over time. One example of that is PGA sutures that we have seen. They lose most of their strength within 2 to 4 weeks, right, because they start degrading quite quickly because they are resorbable. They are meant to be resorbable. Can you recall an example of a suture that is not resorbable? If you have paid careful attention to our lectures on synthetic and natural biomedical polymers, you will be able to recall that nylon and silk sutures are not meant to be resorbable. So, you will have to go back to the surgeon, for example, and have them, the dental surgeon will have to remove those sutures out, as opposed to PGA sutures, which are meant to resorb, right. You do not need a second visit to remove them, but that again comes at a cost. What you want to do is you want to match the degradation rates such that the tissue that is growing eventually will take over the role that the suture is doing right now. So, if you think of this as a plot, right, you are plotting time, mechanical properties are going down with time. What you want to do is look at tissue regeneration or tissue growth rate. So, this is new tissue that is growing, and the one shown in green is your mechanical property, right. So, with degradation, because of degradation, the mechanical properties will go down with time, but the idea is that the material is so engineered, the microstructure and the degradation rates etc. are so controlled that that is not a concern, because eventually the tissue will take over the mechanical properties that this material was originally taken care of. Now, there is a very famous plot here that I have shown, quite often shown in any classical textbook on regenerative medicine using degradable materials. This is a very important paradigm in regenerative medicine. Again, for tissue engineering applications, that is what we are saying here. Porosity and pore size are meant to promote tissue growth, and the degradation rates have to be matched with tissue regeneration rates. And when I say degradation rates, I mean what you are plotting here is a decrease in mechanical properties, because in this lecture we are focusing on mechanical properties. Now, before we move on to the next topic in this lecture, I want you to pause and reflect on this question: is degradation desirable in polymeric biomaterials? We will revisit this question in some detail again when we look at degradation in a dedicated lecture, but the short answer is it depends. It depends entirely on the function and application that the material will be deployed in, right. Is the material primarily intended to perform a mechanical role over the lifetime of the patient? If the answer to that is a yes, then you perhaps do not want the material to degrade, right. Is the material used as a stopgap arrangement in a tissue engineering strategy until the tissue grows? Then in that case you want degradation. So, those are two extremes that you can think about right away, right. And of course, you can have a spectrum in between. So, the short answer to this question is this entirely depends on what your application context is and how is the material expected to perform in that application. And when we say perform, two other things should come right away apart from the intrinsic properties of the material. One is the microenvironment in which it is performing, as well as the time period for which it has to perform. One is the microenvironment where it is deployed, second is the time period or the duration for which that performance is required. So, that is the effect of porosity and degradation. So, we will revisit this idea when we look at degradation later. Now, in the rest of this lecture, we will quickly look at other modes of testing that are relevant to polymeric biomaterials, and we will only give a snapshot of these because we have looked at in great detail the mechanisms involved primarily in tensile testing, and a lot of those concepts can be now translated quite well to some of the other modes of testing with appropriate modifications. So, we will quickly look at compression testing, where you are applying a crushing load or a compressive force primarily to obtain plastic flow behavior and the ductile fracture limits. Now, all these words should make sense because we have looked at what plasticity is, we have looked at what ductile behavior is, we know what fracture is. And because you are compressing the material, strain is negative as opposed to pulling the material under tension. So, the sample actually becomes smaller along the stress axis. And analogous to the stress strain curve for tensile loading, you can define a proportional limit, a yield point, a yield strength, a compressive modulus. All of these things can be defined for compression testing quite well. And I would encourage you to look up some curves of compression testing and see if you can look at a curve, stress strain curve of compression testing of a polymeric biomaterial, for example a hydrogel, and try to see if you can identify some of these points based on your understanding of these concepts from tensile testing. And again, you can have stress and strain equations analogous to the tensile testing. Now, this kind of a compression testing is quite often relevant for load bearing applications, particularly load bearing orthopedic implants, as well as joint replacements, as should be fairly clear to you because you're looking at compressive loads there. Something that may not be quite obvious but equally important is an application where we're looking at in terms of fillers. We've seen that hyaluronic acid is quite often used as dermal fillers, where cohesivity now becomes important, right? Now, cohesivity is a term that, very simply put, what it means is, does the material stay together or does it just spread, right, once it is injected as a dermal filler. Now, do you want the material to be highly cohesive, or do you want it to spread? Depends on the application, right? So, shown here are two applications for dermal fillers. One is cheeks and chin, where you want high cohesivity and you want a stiff gel like material that is primarily performing a structural role, right, as opposed to dermal fillers that are used for lips and under the eyes, where you want moderate cohesivity. Because you want them, for example, in the lips when you smile, etc. Those dermal fillers, if they are stiff and they are extremely cohesive, that's going to interfere with everyday movements of the lips, right. So, you see, you look at what the ultimate function and performance of the material should be in that application, and that in turn determines what kind of stiffness or flexibility or cohesiveness that you want in the material. And this can be sort of tested using a drop weight method, where you're literally dropping it from a syringe, and a higher weight in the drop weight method means the material is more cohesive. Another polymer that we have looked at is gelatin. When we looked at collagen, we saw that it's a deformed or denatured version of collagen. Oftentimes when you look at properties of gelatin, there's something that's called a Bloom number that will be listed. Now, this is not essentially compression, but it broadly falls conceptually under that idea, so we're covering it here. Essentially what you're doing is you're making a gel of gelatin. You're preparing a fixed concentration of the gel. The concentration is fixed, testing temperature is fixed, and the depression or the deformation is fixed. So, you have a plunger that is now going to deform a gel, right, by a certain fixed amount that is fixed at a fixed temperature for a fixed gel concentration, and you are asking what force is required to depress that gel by that fixed amount, certain mm, for example, at that temperature and for that gel concentration. So, that gives you what you would call a Bloom number, going from weak when you have something like 30 to a very strong gel when you have a Bloom number of 325. So, that's sort of what you're talking about. So, it's not compression per se, but you can see how this penetration test for the plunger to penetrate a certain depth into the gel can have some ideas that you can borrow from compression testing. Now, one thing I would suggest that you pause and look up right now is an ISO standard. We previously listed some ASTM standards. So, this is an ISO standard that's used for acrylic resin cements. Another mode of testing that's quite common and popularly used is called torsional testing. This is in the biomedical or clinical context is particularly used for interference screws, right? And here you are applying a torque and you are measuring the angular displacement in degrees. And properties that are of interest here would be torsional stiffness, yield torque, and the maximum torque that the material can withstand. Higher torsional stiffness simply means is desirable, and it simply means that it's going to resist deformation, it's going to resist twisting, and that can have very significant consequences for the insertion of cannulated interference screws, such as shown here. This is a tibial anchor used in ACL reconstruction surgery made from PLLA and hydroxyapatite. So, shown here is the torque angle curve for a typical torsional test, where you see there is a sort of a elastic like region initially, and then there is a yield point. You can define a yield angle beyond which plastic deformation happens, and thereafter because of further deformation, then you can have again in this region you can have strain localization, for example, right, where a certain region in the screw can start taking a lot of load and then suddenly it can fail, right, it can crack and fail, and the crack propagates and it fails, right. So you see there are this is a very different type of a test, but you still see that there are some ideas that you can borrow from the concepts we have learnt earlier, namely in terms of an elastic region, in terms of a yield point, in terms of plastic deformation thereafter, and in terms of a maximum torque that the screw can withstand. Of course, you want to operate well below that maximum torque, right, as a surgeon, right, and of course beyond which it's going to fail. So that's torsional testing. Another important testing that is often done is called flexural testing, or what you would call a 3-point bending test, where the sample is anchored on both sides and is depressed in the middle, load is applied in the middle, and the sample undergoes both tension and compression. So like I said, it's supported at both ends and the load is applied in the middle. You can now determine a modulus of elasticity, which is simply the tendency to resist bending. You can also define a flexural strength. Again, you see what's important here is to note that although the mode of testing is quite different, we are still borrowing ideas that we have seen earlier in tensile testing in terms of modulus, in terms of strength, etc., right, except you are adding some minor caveats here saying that this is flexural strength. So for example, here this is the maximum stress that can be applied to the tension side to fracture the sample, and shown here is a sample of a force deflection curve. Of course, this equation assumes a rectangular cross section, which is typically used as shown here, and F is simply the force. And you can think about using such a testing modality for PMMA denture base resins that we have seen in great detail in lecture 17. Now, these kinds of dentures will have a certain flexural length on their own, but we saw, if you remember in lecture 17, that fillers are often used, and there we would have said it's to improve the mechanical properties. Specifically, we are noting here that zirconia kind of ceramic fillers or glass fiber fillers significantly improve the flexural strength of these kinds of PMMA dentures, and you know, these kinds of dentures, base resins, can undergo quite a bit of bending forces where they are employed, and so it's very important that they are strong in this mode of testing. And the last test that we will look at least in this lecture, is called impact testing. Now, impact testing simply is the ability to withstand sudden or forceful loads without fracture. So what you have in this kind of, and there are multiple ways to do this test. What you're showing here is an IZOD, what's called an IZOD test. What you have here is a sample with a notch anchored on one side, and you have a pendulum or a striker that's coming from one side. It's going to strike and it's going to go to the other side, and that's going to fracture the sample. So the energy lost by the striker is absorbed by the sample to fracture, and what you're asking here is how does that connected to the impact strength, right? Essentially, you're using very high velocity. That's what impact is, right? Even in accidents, we talk about impact, right? Because you're using high velocities. So here also, impact should be correlated to a high velocity, and this is in turn, from a mechanical perspective, is related to the energy absorbed, which by now you should be able to connect to toughness. And examples of tissues or regions in the body that could be subjected to such kinds of impact forces include joints. So any joint replacement has to be sort of carefully accounted for in terms of this kind of testing. An impact strength, typically measured in joule per unit length meter, it's the energy absorbed per unit thickness at notch during fracture. Sometimes you'll also, depending on the standard you use, you'll also see units of joule per meter square per cross sectional area one small caveat to note, but nevertheless the point here to note is you are looking at the energy absorbed per unit length or unit cross sectional area at impact. And as we have seen earlier, this ductile brittle transition temperature is the temperature at which the fracture energy drastically decreases, because you are going from ductile to brittle. So at around and on two sides of the temperature, the fracture energy is going to drastically change. And that is the connection that you want to make between what you are talking about here in terms of impact testing and the concepts we have seen earlier in terms of the BDT, brittle ductile transition, or the ductile brittle transition, depending on which way you are going. And the material of relevance here, the example here we are looking at is ultra high molecular weight polyethylene, which among all known plastics has one of the highest ISOD impact strengths. And now I will leave it to you as an exercise to connect if this has any bearing on its use as a liner in orthopedic hip and knee replacement devices. Before we conclude, we will offer a few comments on failure modes in these materials. We have hinted at them, but we will look at them in slightly more detail before we close this lecture. And we are broadly going to make a distinction between brittle and ductile mechanisms. Now, the brittle mechanism is largely looking at sudden failure after the elastic region, which is going to give you a clean fracture like we have seen earlier, sudden catastrophic failure, as opposed to plastic deformation, where you will have necking, significant yield and deformation before the material fails. And from a molecular perspective, what you are seeing is that the hard and brittle materials are associated with elastic energy with chain scission, or elastic energy associated with chain scission, that is going to lead to complete rupture of all the bonds, covalent bonds, where the material will snap. And ductile materials, the connection is to be made to plasticity and viscous dissipative processes, right. Elasticity is the ability to store energy. Here we are talking about energy dissipation in the form of viscous processes. Of course, the role of in such materials you also have slippage and molecular disentanglement occurring from secondary interactions, and of course at failure you will have chain scission leading to snapping of covalent bonds. In brittle fracture, particularly for high DG polymers, you will have something called crazing, which is simply a localized region of plastic deformation. That is what crazing is, leading to the formation of microvoids and fibril like structures. So, you see here, this is what a craze is. What you are seeing here is the presence of microvoids and these long elongated fibrils, right, which can also happen, by the way, due to aging processes, right. So, you have to connect this to aging. Extended use over time can lead to some of these processes in brittle high TG polymers, and that can serve as a precursor to crack initiation and propagation. So, you see here a failed fiber which is called a crack, right. So, with time all these fellows are going to completely come apart and fail, crack and fail, right. So, the formation of microvoids and fibrils. So, the voids can expand leading and fibrillar degradation leading to craze breakdown, crack growth and eventual failure. So, when it fails, this whole thing is going to snap, right. And here one relevant thing you can think about is Griffith's theory for crack propagation in brittle or glassy polymers, which is simply the critical stress required to for a crack to propagate. Now, contrast that with mechanisms that exist in ductile thermoplastics, where you see shear yielding. So, you will see softening post yielding, as we have seen in this kind of a curve, right, plastic deformation and shear band formation, where in the plastic deformation you can have all kinds of things like molecular relaxation, orientation, some chain alignment, slippage, etc. Thereafter you see strain hardening, and as we have seen in the previous lecture 22, we saw that that's because of the alignment of the crystals, right? All the crystalline domains, although they have different regions of them have come apart from the lamellae, all of them are now aligned. Amorphous and crystalline domains are all now aligned. So it's and that leads to strain hardening, and with further increase in the load, the material is going to fail. Ultimately, the covalent bonds will all come apart and snap, right? So with that, my hope is you've got a reasonably good sense of not only the effects of operating conditions such as strain rate, temperature, etc. on mechanical properties, but also the role of microstructural mechanical properties, the different modes of testing that are relevant. Of course, we have only covered a small snapshot. I would encourage you at this point to look at, there are of course many other modes. I would encourage you to look at two particular modes that we have not specifically looked at, but these are relevant for clinical biomedical implants, namely burst pressure for vascular grafts and hardness for implant liners. There is what's called a hardness test. So there are n number of such tests, all of which we possibly can't cover in a course like this, but the hope is you now have the base and the conceptual understanding to now appreciate other kinds of specialized testing modes as and when you encounter them, and you can do this as a test and see if you are able to understand what burst pressure is for vascular grafts, and for implant liners what is the role of hardness, what are the tests, what are the properties you can extract from them, and what kinds of properties we are talking about for polymers that are used in those kinds of applications. So with that, we will close this lecture.